and will be available at the end of the presentation on the Central Ina website. Also, that everyone is on mute. If you have questions, please put your questions into the Q&A section. Lauren Hevner, that's joining us today, will be manning that as well. We do have a raise hand function, so if you have questions along the way, you're free to use those. And Central Ina would just like to welcome everybody here today. So our speakers today, we have Lauren Hevner, who is the Piedmont Regional Manager with SHIP. She joined the North Carolina Department of Insurance as a member of the Seniors Health Insurance Information Program back in 22, and she currently serves as the SHIP Piedmont Regional Manager. As the Piedmont Regional Manager, she recruits and trains SHIP volunteers, counselors, and county coordinators. She provides outreach to her counties through speaking engagements, exhibits at conferences and health fairs, does radio and television appearances across the 22 counties that she supports. Lauren studied at the University of North Carolina at Charlotte, majoring in public health and minoring in gerontology. Prior to joining the SHIP staff, she worked as a program SHIP coordinator at the Lincoln County Senior Services, and she is also a certified dementia practitioner and a strong advocate for individuals living with Alzheimer's disease, reflecting her deep commitment to the aging population and their unique needs. We also will have presenting today Jeannie Shipshe. She is the, and I never get it right, Shipsky. Thank you, Jeannie. I know that.
Skepsy like Pepsi.
Oh, well, there you go. I've been
Although it doesn't
saying
look like
it
that.
wrong for 25 years. Anyway, Jeannie
So
joined the
does my
Department
dad,
of,
Cindy.
oh, well, good. That makes me feel better. As a member of the Senior Health Insurance Information staff in 1996, she currently serves as the SHIP Field Operations Manager and Central Regional Manager. As the Field Operations Manager, she oversees the SHIP Regional Manager team and is responsible for coordinating statewide partnership efforts. As the Central Regional Manager, she supports Alamance, Caswell, Chatham, Davidson, Forsyth, Guilford, Randolph, Rockingham, and Stokes counties. She recruits and trains their SHIP volunteers and counselors and county coordinators. She provides outreach through speaking engagements, exhibiting at their conferences and health fairs, and does the radio and television as well in the 9 counties that she supports. She received an associate's degree majoring in medical assisting from Wingate College, now a university, in 1986. And prior to joining the SHIP staff, she worked as a certified medical assistant in cardiology and OBGYN practices in High Point, the city where she was born, and as a relations representative and a training and quality assurance managers at Cigna. Jeannie and her family reside in Greensboro currently. So I'd like to welcome both of you today. And Jeannie, I'm going to turn it over to you for now. And thank you all for joining us.
Thank you, Cindy, for that warm introduction. And usually when people introduce me, they'll say, and we have with us Jeannie, and they'll just pause and stop. It's an Italian name with a lot of vowels in it. And as I said, my dad doesn't even try to pronounce it. So thank you very much for the introduction. And it's great to see you again. I used to have Mecklenburg and the counties that Central Carolina Area Agency on Aging support. But when Lauren joined our staff a few years ago, she kind of took those counties from me and is doing a great job as your Piedmont Regional Manager. So it's nice to be back in this area. And we do appreciate the opportunity for you allowing us to present very important information that we have today. So I'm going to turn off my camera so that it's less distracting, and hopefully you guys will still hear me. And we have a lot of things to talk about, but we don't have a PowerPoint. We have some documents that we're going to show you and some websites that we're going to demonstrate. So what you should be seeing now, and I know it's busy because it keeps on pulling across at the top, is our SHIP website, which is www.ncship.com. And as Cindy said, Lauren and I represent the SHIP program, which is a division of your North Carolina Department of Insurance. And I'm going to tell you a little bit about our program in case you haven't heard about us before. I always ask people when we're doing a live in-person presentation, how many people have heard of SHIP? And, you know, we get sometimes half of a room or a few hands or a lot of hands. It just varies depending on the group and where we are. But we want to make sure that everybody knows about us before they need us. So again, thank you for this opportunity, Cindy and Central Carolina Area Agency on Aging. So SHIP, SHIIP with two I's, is the Seniors Health Insurance Information Program. And that's a mouthful. So we call ourselves SHIP for short. We are a division of the Department of Insurance, so we are a state agency that was created in September of 1986. So a couple of months ago, we turned 39 years old. So next year we will be 40 years old, and we've been around for that long assisting people that are on or going on Medicare with their Medicare related questions and problems and concerns. And we do that with state funding that we've received since 1986. We were the second program like ours in the country to help people with Medicare in a neutral, objective, unbiased fashion at no cost to the client. And 6 years later, in 1992, the federal government said, look at what North Carolina's been doing for their Medicare beneficiaries. Every state in the country has to have a program like North Carolina. And we were very proud of that. And what is especially great about that is, in addition to the state funding that we have been receiving, because we're a state agency, we started receiving federal funding as well. And the majority of our funding does come from the federal government. So we're very appreciative of both the state and federal funding that we receive because it allows us to do what we do on several different levels. So one thing is that we have a toll-free number, and because we're a state agency, we're based in Raleigh. If you jot the number down, and I know Lauren, who's my Vanna today, is going to type this in the chat box, but the number is 855 408 1212. And you all, what's good about that number is I tell people this all the time, and you'll see it here on our website to the right where the phone is. It's not just a SHIP Medicare number, it's a Department of Insurance number. And if we were meeting in person, I would ask you for a show of hands, how many of you have homeowners insurance? Or how many of you have automobile insurance? And if you raise your hand, this number, 855 408 1212, is not just a SHIP Medicare number, it is a Department of Insurance number. So any question that you have relative to any kind of insurance, you can call 855 408 1212 Monday through Friday, 8 a.m. to 5 p.m., and we can assist you. You listen to the menu and you press the number of the agency or division that can assist you with that particular insurance related question or situation. When you call that number SHIP Medicare, we're number 2. So that number is available to anyone with any kind of insurance related question. We also have a wonderful website that we're looking at right now, www.ncship.com. At the top where you see something constantly moving, that is our banner that pulls over. There's about there's about 4 or 5 pictures that change depending on when it is. We have things that change on a monthly basis, but a few of the things are there. And these are things that we put at the top because they're important. Usually we have an OEP banner that pulls across, but I guess we haven't gotten that up yet. But it does say that October is National Breast Cancer Awareness Month, and that will change. That should actually change in November. So we will get right on changing that. Below the board that pulls across at the top or the banner, there's 9 boxes or squares, and I refer to this as the tic-tac-toe or Brady Bunch board. Whether you played the game as a child or you watched the TV show it as a child, there's 9 boxes here, and there's different things in these boxes. If you're interested in being a SHIP volunteer counselor, there's a box for that. There's a box that talks about our sister program, Senior Medicare Patrol, and we're going to talk about that in just a few minutes. How do I contact SHIP? That was in the banner at the top, but it's so important that it's in this tic-tac-toe Brady Bunch board as well. And I'm going to actually click there just to show you while we're here, that if you want to reach out to us, again, our number is there for our office in Raleigh. But one of the unique things about our program is, in addition to the office in Raleigh, when our program was created in 1986, the insurance commissioner at that time said, we're going to have an agency in every county of North Carolina, Alamance to Yancey, that can assist people locally. And that's where our certified SHIP counselors are going to be based out of. So if you go to our website, click on Find a SHIP Counselor, you can find in every county, Alamance through Yancey, our SHIP coordinating sites. And Lauren and I were actually just in Yadkin County last Friday, and we currently do not have a SHIP coordinating site there. We haven't had one for several years, so we would just have to assist you out of the SHIP office in Raleigh. I'm going to click on Mecklenburg because that's where Central Carolina Area Agency on Aging is located, and it's one of the counties that they support and serve. And you will see that the Shepherd Center of Charlotte on Hawthorne Lane is our SHIP coordinating site, and it gives you the address and phone number. It doesn't tell you that Elisa Selleck is the coordinator there, but it does give you that agency's contact information. And if you reach out to them, you should ask for SHIP help in case Alyssa isn't there. They know what to do and where to route that call. So there is an agency in most every county of North Carolina that coordinates our volunteer counselors, and you can call locally instead of driving or having to call to Raleigh for assistance. It just makes it a little bit more personal, and we provide services on a local level. As of 1992, I mentioned that there are SHIP programs in all states across the country. They might not be called the Seniors Health Insurance Information Program like they are here in North Carolina because we have our own names. We had our name, the Seniors Health Insurance Information Program, before SHIPs were created nationally in 1992, and we've kept that name ever since. So if you click on Find a SHIP in another state, you click on North Carolina, it's going to give you our web address link there that you can click on, and it's also going to give you our toll-free number for the Department of Insurance. And it's got our logo here. If you want to find the SHIP in another state, for example, my father-in-law is on Medicare and he lives up in New York, then you can click there and it gives you the contact information. And their SHIP with one I is called HICAP, the Health Insurance Information Counseling and Assistance Program. So you will see how to locate the SHIP in another state, as well as the SHIP sites in every county of North Carolina. So that's very important that you can get to whomever you need, whether it's in our state or out of our state. Okay? All right, so I'm going to go back to our website. And also in the Brady Bunch or tic-tac-toe board is information about Medicare A, B, C, and D because there are currently four parts to Medicare. I always ask myself, and every year I get closer to being my own client. I don't have many years left to go, but I always ask myself, how many parts of Medicare will there be when I become eligible for Medicare in just a few years? Hopefully, at some point, there is a benefit for dental and vision, but at this point, there is not. Medicare supplements, that's the box in the middle. And we've got a box on long-term care insurance. We don't get a lot of questions about that, but there is a box for that. I'm new to Medicare. What do I do? And Lauren will tell you that one of the main things that we do at SHIP is that we assist people who are going on Medicare, regardless of age or whether they're over 65 or 65, and they're under 65 on Medicare due to disability. So don't let the S in SHIP, which stands for seniors, mislead you, because our goal is to assist any person that's on or going on Medicare, regardless of age. And there's a box for that for those people that are new to Medicare. There's also a box for getting help for paying for your Medicare costs, whether they're medical services or prescription drug costs, because there are assistance programs with qualifying dollar amounts, and we're going to talk about a few in just a minute. We screen every person that we counsel and ask them some sensitive questions and personal questions about their money, their income, assets, and resources, not to be nosy, but so that those people don't fall through the cracks. And so, if we feel like a person may qualify for assistance through extra help for Part D, medication cost, prescription drug plan cost, or some Medicaid level program, then we can do those applications right then and there, making it convenient for that person and not passing them on to another agency or organization. We also have a file a complaint box. We highly encourage people that we talk to that identify that there may be something that's wrong and it needs to be reported, and there is an area to file a complaint, and we highly encourage that because if you don't file a complaint, it's just going to continue to happen to other people, and we want to get a jump on things and be proactive instead of reactive. In the bottom left, under the More heading, there's again, get help paying your Medicare costs. That's in the banner at the top, in the tic-tac-toe Brady Bunch board, as well as here. It's just that important. We don't want those people with limited income, resources, and assets falling through the cracks. So it's on our website in three different places. There is an area for Medicare Advantage plans. We have loaded the information for the Advantage plans in 2026 there. And Medicare Advantage or Part C plans, they do vary county by county. So we have it broken down, again, Alamance through Yancey, as far as which Medicare Advantage plans are available, excuse me, in which counties. Medicare Part D, the prescription drug benefit, that varies state by state. And next year in North Carolina, there are about 12 plans that offer Medicare Part D prescription drug coverage, and those companies and plans are listed under that tab. There is a special area for those people who are under 65 on Medicare due to a disability. And the big difference for those people are the plans that they can get as far as supplements are concerned, are more limited until they turn 65, and the rates are more expensive for those Medicare supplement premiums. And we do note that information in that Medicare disability area. We do have information on employer group health plans, which does include some state health plan of North Carolina information, as well as information for TRICARE for Life and veterans benefits eligible persons. Third place, search for a counselor by county or for a SHIP in another state. Again, it's that important, and we want you to be able to do that on our website. If a coordinating site tells us of an event that they have and they let us know about that, we can post that information here so that people have access to it. This is the password protected area for coordinators and counselors to get some information about our training materials and so forth. If a person is looking at a Medicare supplement or Medigap policy, we list the companies alphabetically by name with their phone numbers, and that's listed there. When we counsel people, we go through a couple of things that are very important prior to their counseling session, and that's a disclosure form that we have to complete for every client that's there, and then additional resources. And if people have questions about dental, vision, and hearing coverage that original Medicare doesn't cover most of the time, then we refer them to SHIP additional resources for a list of the carriers for dental, vision, and hearing plans and companies in North Carolina. Okay, so that's our website. Just wanted to show you that. And again, we are here at SHIP to assist you with neutral, objective, unbiased counseling and assistance at no cost because of that state and federal funding that we receive. We don't sell insurance. We don't get a commission. We're not licensed agents. And not that that's wrong or bad, that's just not what we do. We receive federal funding to not do those things. And if we did those things, we would get in trouble. So we don't sell, we don't get commission. We assist in a neutral, objective, unbiased fashion. Any medical or financial information that people share with us is kept confidential. And our goal at SHIP is that people have the best coverage at the best cost. That's what we care about. So when you come to us, that's what we're looking at. So that's who we are, what we do, and you know how to contact us now. And again, Lauren put the phone number and the website in the chat box. So thank you for that, Lauren. And just like every state has a SHIP program to help people with Medicare questions, every state also has a senior Medicare patrol. And in the tic-tac-toe Brady Bunch board, that's the second box at the top row, and it's the middle box. So if I click on that, then it's going to give you information about North Carolina's Senior Medicare Patrol. And in North Carolina, we're fortunate that our Senior Medicare Patrol is housed within our SHIP program. So the right hand knows what the left hand's doing. So we're very fortunate for that. The mission of SMP, or the motto, if you will, is to protect, detect, and report. Protect refers to protecting your Medicare card. Now, if you visualize the red, white, and blue Medicare card from years and years ago, Medicare Parts A and B started in 1966. And that's why we call it original Medicare, because it was the original form of Medicare. It was the only form of Medicare in 1966. Part A is the inpatient or hospital part of Medicare. Part B is the outpatient or medical part of Medicare, and they combine to form original Medicare with the red, white, and blue card that used to have a Social Security number on it from 1966 until about 10 or 12 years ago. And the government finally realized that it probably wasn't the best idea to have a Social Security number on a Medicare card. So they started issuing new Medicare cards for new Medicare beneficiaries with no Social Security based number. And then they went back to people that already had a Medicare card with a Social Security number and they replaced those. So currently, anyone that's on Medicare should not have a red, white, and blue card with a Social Security based number on it. If they do, they need to reach out to Social Security or Medicare to get a replacement card. If they try to present a Social Security based number card to their healthcare provider, that should not be accepted because the provider can't use that number to file medical claims. So once in a while, we find people with those old Social Security based numbers and we help them get a replacement card without a Social Security number. So the new card without a Social Security based number, you can safely carry that in your wallet or purse. SMP encourages people to flip it over on the back side so that that's facing up, just in case. And if you have a Medicare Advantage plan, then you would put that in front of your red, white, and blue A and B card. But if we counsel people at SHIP, we need that red, white, and blue card no matter how you have your Medicare because it gets us into the Medicare system. And sometimes healthcare providers need that red, white, and blue Medicare card number as well, even if a person has an Advantage plan. So we tell people you can safely carry that. Just protect it like you would a debit or credit card and never give it out over the phone. Detect means to look at your Medicare statements, whether you have A or B or an Advantage plan or a prescription drug plan, or you have a supplement or an employer group plan. Look at your statements when they come out. And a note to make, that if you are getting paper Medicare summary notices, as of 2026, they will no longer be mailed out on a quarterly basis. They will be mailed out on an every 6 month basis. So that will be something new and different in 2026. I really think the government is trying to encourage people to receive an electronic version of the Medicare and You handbook that comes out in the fall. And they're trying to encourage people to get their Medicare summary notices electronically. You guys, it does make sense and it saves money to get things electronically. It saves paper and postage. But I know I like having my paper copy of my Medicare and You handbook. And some people just like seeing their summary notice, which you can print that out. But I really think that's what the government is going towards, and it would save a lot of money. And then report. If you do suspect something's not quite right, trust your intuition. Call your healthcare provider to question. Call your insurance company, whether it be Medicare, an employer plan, TRICARE for life, or a supplement or an advantage. Call the insurance company in question. And if something still doesn't feel right, trust your judgment. Reach out to us at Senior Medicare Patrol. It's the same number as SHIP. It's the Department of Insurance number, and they will ask questions and you can give detailed information to determine if it is truly fraud or abuse. And if it is, we will take necessary precautions and send it to the appropriate sources. If it's happening to you, it's probably happening to other people. And I tell people, even if it's only $1 that you're being wronged, think of it this way. If every person in our country that's on Medicare is wronged by just $1, think of the impact that that would make on the Medicare trust fund. And we want Medicare to be around for years and years to come. If S&P were here, they would tell you that $60 billion a year is wasted on Medicare fraud and abuse. So help us be good stewards of Medicare funding and protect, detect, and report. Okay? So that's who SHIP is and what SHIP does, and that's who S&P is and what S&P does, and how you can contact both programs. So, the third thing that I want to go over today, and we don't have a document on this, but we received an official memorandum from the federal government a few weeks ago, and this was during the shutdown. So, thankfully, we did receive the information during the shutdown that the Social Security cost of living adjustment in 2026 is going to be 2.8%. Now, I know that's not great. But the good news is it's better than 2.7% and it's better than 0%. And I've seen it lower and I've seen it zero and I've seen it be higher. But it is 2.8% for the Social Security cost of living adjustment next year. Social Security is the agency that is the enrollment, entitlement, and eligibility source for Medicare. So if people have questions, and Lauren, can you see the Social Security website now?
Yes, I can.
Wonderful, thank you. So we get this pop up, and it just reminds us that during the federal shutdown, the local Social Security offices will have reduced in person services. And I want to remind you all that we can no longer just walk in. Well, you can just walk in a Social Security office, but they will not see you without an appointment. So this is very important that there are reduced in person services. And even with those in person services, you have to have an appointment. Now, I'm going to show you because it used to not be as territorial, but we partner very closely with our friends at Social Security. There is not a Social Security office in every county or in every town. They're kind of spread out over the state. And we want to make sure that people are using or going to the appropriate Social Security office so that they're contacting the local Social Security office that's appropriate for them according to the zip code of where they live. So if you go to the socialsecurity.gov website and scroll all the way to the bottom, under the support heading, there's find an office. And if you click on that and pull down and you put in locate an office by zip, you click on that box and you put in your zip code. And I'm just going to put mine in 27407. And I live in Greensboro. And then you click on locate. fortunately, I'm 2 miles from our local Social Security office. So if I need something from them or they need something from me, I am not far away. But it does give their contact information as far as where they're physically located, their direct local phone number, a TTY number for hearing impaired persons, a fax number. If you've got forms that you need to get to them, you can fax them directly to your local office. And if you do need to make an in-person appointment or deliver something, they do have a drop box between the two sets of doors. Then it tells you the hours and days of operation. And so we want to make sure that people are aware of where they need to go and when that office is open. But if you're going to go see someone, you do need to make an appointment. Okay? So please be mindful of our friends at Social Security and go to the office that is appropriately designated for you depending on your zip code. So the next thing that I want to bring up is a document on the updates and changes for 2026. And I may have to grab that. I thought I had that pulled up. So an important thing happened in the fall around September, and your Medicare new handbook came out. And you know what? Let's see. I did have it pulled up, guys. There it is. I apologize. So there it is. So your Medicare new handbook is your owner's manual if you have Medicare. And Lauren, hopefully you guys are seeing that. And I always encourage people, when you get this booklet, I tell people, hey, Lauren, you got your hand raised?
No, I was coming off mute to tell you, yes, we can see it. I accidentally hit the
Oh,
wrong
thank
button.
you.
Yep, we can see it.
Thank you, ma'am. So, this is your owner's manual. It's not something you want to read from front to back cover in one sitting. It might actually put you to sleep, but it is a great reference tool. And there's a lot of good information. And when people ask me a general question about Medicare, this is the first place I go, Medicare and You. And the reason I do that, a couple of reasons, is a person should have that because they, unless they told the government they want to get it electronically, they get one per household to share or fight over. And so it's there in the booklet that they should have in front of them. And it's not Jeannie Skepsy misinterpreted wording, misinterpreted, not interpreted, misinterpreted wording, and it is an official government wording. So that's why I go to this document first. And so usually most any question that I get asked that's general Medicare, I go to this document and give a person the answer. So every year I remind people that the government puts a lot of money into printing and mailing this document. It's their duty as a good Medicare steward to keep up with their handbook. And if nothing else, don't you want to know what's new and important? So page 2 of the handbook tells us what's new and important for the following year. And you'll see the blue headings you'll see the headings in blue. So it tells us that capping what people pay for their prescription medications is going from $2,000 this year. This was the first year that the cap was initiated, and it's going to increase to $2,100 next year in 2026. So that's new and important for next year. Also, relative to your prescriptions, there's going to be more drug cost savings under the Inflation Reduction Act that we're going to look at in just a minute, because this is the first year that 10 medications, the prices will be negotiated. Now, when we look at the amount of some of those, they're still expensive, but they are lower. They're going to be lower than what they are now. So some help is better than nothing, and that's a start. And we're going to look at the Inflation Reduction Act chart in just a minute. Meeting your healthcare needs, Medicare now pays for advanced primary care management services each month. And it just says providers that offer these services must give you 24-hour, 7 days a week access to your care team. And this gives information about that. You can see page 31 for more additional information about your advanced primary care management services. It also reminds us, and some of these things aren't new, they're just important, but it reminds us that early detection matters. I'm going to go ahead, it was on my agenda, but go ahead and talk about preventive health care. That's one of the things that we get special grant funding for. We get special grant funding called MIPA funding, and Cindy, you may be familiar with this by working at the Area Agency on Aging, because some of the AAAs receive special MIPA funding from SHIP to talk to people about a couple things. MIPA stands for Medicare Improvements for Patients and Providers Act. And for us, that's relative to extra help for Medicare Part D for people with limited income and resources and assets. But it also includes preventive health care. So we remind every person that we come in contact with, either an exhibit or a presentation or direct counseling, of the importance of taking advantage of the preventive benefits that Medicare covers. Usually, for most preventive benefits, there's no deductible to meet and there's no copay. So I can't afford these preventive benefits is not a good excuse, because usually there is no cost for a preventive benefit under Medicare, whether you have A and B or a Medicare Advantage Part C plan. And it mentions colorectal cancer screening services. There are several listed under that heading or that umbrella. But I do want to mention that on pages 30 to 54 of next year's Medicare New Handbook, if you see a little blue apple icon, that designates that that's a preventive benefit. They are listed alphabetically, and it gives you detailed information about those preventive services, how they're covered, how often, who's covered. So we remind people to look at their Medicare New Handbook on pages 30 to 54 and look for that blue apple icon. Okay? And then it does remind people to help fight Medicare fraud, abuse, and waste. And that again is through the Senior Medicare Patrol program that's in every state. Again, ours is through our SHIP program, and you know how to reach out to us for that. Keep your eyes and ears open. And the statement these days is, if you see something, what? Say something. So we want that to be relative to your Medicare as well. All right, that's what's new and important for next year. Another document that we want to pull up is the Inflation Reduction Act document. And I just want to share with you a little background. So in August of 2022, President Biden signed the Inflation Reduction Act, or it's known as the IRA, into law. And this law actually makes improvements to the Medicare system by expanding benefits, lowering drug costs, and improving sustainability of Medicare program for generations to come. And those are great things. The law provides meaningful financial relief for millions of people who have Medicare, excuse me, by improving access to affordable treatments and strengthening Medicare both now and in the long run. And you'll see that this actually started transitioning in 2023, a couple years ago, and it goes until the year 2029. So there's a gradual transitioning of the Inflation Reduction Act. And what you'll see under every year is what takes place. So in 2023, the first year of implementation, you'll see the things that happened. In 2024, last year, you'll see the things that happened. This year in 2025 is the first year of the $2,000 out-of-pocket cap for Medicare prescription drugs. And then next year, that's when we will see the first year of negotiated Medicare prescription drug cost or prices. And here's a list alphabetically of the 10 medications that are included in that negotiation. Okay? And then in subsequent years, in 2027, there will be 15 more Medicare prescription Part D drugs. In 2028, 15. And in the year 2029, 20 Medicare Part B and D drugs. And that's for 2028 and 2029. Additional Part B as in boy and D prescription medications. Okay, so when people ask, what's happening with Medicare, this IRA was passed, and when the negotiated prices go into effect next year in 2026, people that are enrolled in Medicare prescription drug coverage would save under this project that's the standard benefit design, an estimated $1.5 billion. And these savings from the negotiated program are in addition to savings from other cost savings, such as the cap. So these are in addition to the $2,000 this year and $2,100 cap next year. So as the years go on until 2029, we do talk to people about the Inflation Reduction Act and the impact that it's going to have on Medicare for that particular year. Okay. Now, another thing that's important, it's a part of this MIPA, Medicare Improvements for Patients and Providers Act, in addition to preventive benefits, but the Extra Help program. And when Medicare Part D started in 2006, it wasn't just to provide prescription drug assistance through a Part D standalone plan or Medicare prescription drug coverage under Part C Medicare Advantage plans. It was also to give those people with limited income, resources, and assets some assistance with their premium cost for those plans, as well as their out of pocket copays and deductibles. So, Extra Help is an assistance program for people with Medicare drug coverage, and it does look at income, resources, and assets. Now, it's the government, so it doesn't make some things easy. So when we screen every person that we counsel for Extra Help, we ask them what their income amounts are, whether they're individually filing their taxes or they're married filing joint taxes. And married for Extra Help applies to those people who are married and living together. That's very important for Extra Help purposes. So if you're married, if you're individual, then the income amounts are a certain thing. And if you are married and living together, they're a certain amount as well. So this year, I'm going to give you this year's amounts, which I know are ending, but you can kind of compare. So this year, an individual income amount for Extra Help is $17,220. Okay. And I'm sorry, that's resources and assets. So the income amounts are 1,956 for an individual. And for a married couple living together, that amount is, I'm so sorry. I'm having to look at my document. 2,000 and 2,644. So 1,956 a month for an individual for Extra Help. And then for a married couple living together, the amount is 2,644 combined per month. And there's things that are counted as far as like income from Social Security, income from employment, income from you have an account that deposits an amount into your checking or savings every month that transfers that money. Those things are considered income. Those figures are good now until April the 1st. So those figures for income for Extra Help will not change. What is changing is as of January the 1st, the Extra Help resources and assets. Currently, for an individual this year, the resource and asset amount is $17,220. And resources and assets are not what you're pulling in because that's income, but it's your amount in checking or savings, stocks, bonds, CDs, IRAs, the worth of any property that your primary residence is not on. Those things are considered to be resources and assets. And this year's individual resources and assets for Extra Help, 17,220. Next year, the individual resources and assets for Extra Help are 18,090. And that starts January 1. So there is a slight increase on that. For a married couple living together, the Extra Help resources this year are $34,360. And for 2026, starting January 1, a married couple that's living together, their Extra Help resources and assets amount is $36,100. So I wanted to give you this year's figures that end at the end of the year for resources and assets to show you that there will be an increase for that amount for 2026. So every person that we touch when we counsel them or when we do a presentation, we do mention extra help and we screen people so that no one falls through the cracks. We can do those assistance programs applications right then and there. And if we're doing an application for extra help for prescription drug coverage and cost, and we determine that that person's income and resources are lower than the extra help eligibility amounts, they may qualify for some assistance from the state to pay medical expenses through Medicaid or a Medicare savings program. So we try to be all inclusive, and we've actually got a little document that we use to screen people to see if they're below that limbo stick, so to speak. Okay. Now, the last thing I want to talk about is Medicare open enrollment. And people get confused a little bit. I just exhibited at a Baptist State Convention annual meeting in Greensboro the last 2 days, and people from all over the state of North Carolina were there. And we just want people to know a few things about Medicare open enrollment. Now, there's several open enrollment periods, or there's several enrollment periods, I should say. Medicare open enrollment used to be called the annual election period, or AEP, and it's still referred to as that, and you will hear that on occasion. But it started as AEP, the annual election period, back in 2006, actually the fall of 2005, because Medicare Part D started in 2006, and that is a prescription drug benefit that's offered to persons on Medicare. And for 40 years, from 1966, when Medicare started, until 2006, there was no prescription drug benefit. People had to pay for their prescriptions out of their pocket. And we know with that, people either scrimped and saved, and they paid for their medicines, but maybe they did without other necessities, or they got medicines and only took one a day instead of two a day, or they didn't take medicines altogether because they couldn't afford them. So thank goodness for Part D that started in 2006. And that was an act of Congress because Congress controls Medicare. And that was a good thing. So we got the Medicare drug benefit that's been around since 2006, but a provision of Medicare Part D is the extra help program. So helping people be able to afford their prescriptions through assistance with premiums and deductibles and copays. Again, we screen people to determine if they may qualify. And if they do, and they're awarded extra help, we've seen people save tremendous amounts of money and be able to comfortably afford the medications that they need to take as they are prescribed. So Medicare open enrollment, or Medicare OEP, is defined as a 7-week period from October 15th through December 7th every year that allows a person to compare their Medicare prescription drug plan, whether it's a standalone Part D or it's a part of a Medicare Advantage Part C plan. And so what we at SHIP do is we dedicate that 7-week period to helping people look at what they've got this year, if it's going to be around next year, what's it going to be like, and how does it compare to other plans that are available. Or if the plans that they're in, the plan that they're in is excuse me, if the plan that they are in this year is not going to be around next year, we tell them what their other options are. So we want people to know that there is a 7-week period from October 15th through December 7th of every year called Medicare Open Enrollment, or OEP, and that is the time that they can and should compare their Medicare drug plan for next year. And why is that? If your answer is because the plans change every year, then you are correct. So we try to really preach that to people, and I do, and I know Lauren does outreach, and when we do that and we leave, we're like, how many people got the message that you need to compare your drug plan every year during open enrollment, whether it's through SHIP, a neutral, objective, unbiased source at no cost, whether it's calling 800 Medicare 24 hours a day, 7 days a week, and getting assistance from a trained professional from the federal government, or going through your agent, your local agent. You need to compare through someone to ensure that you are familiar with and aware of what's available next year and that you're getting the best coverage at the best cost or an affordable cost. And that's what is important, and that's what it's all about. So we are here to remind people that Medicare open enrollment is here and that it's important to compare their plan every year. And you guys, I'm going to use a couple of examples. One example is there was a Medicare drug plan in 2024, a standalone plan for people that have A and B Medicare. And why do you need a drug plan if you've got A and B and a supplement? Because A and B, original Medicare and supplements, do not cover outpatient prescription medications. That's why you need Medicare Part D. Or if you have a Medicare Advantage Part C plan, it may have a medical and prescription drug component. Okay? So if you've got a Medicare drug benefit and you're not comparing your plan every year, here's what may happen. So for people that have standalone Part D, in 2024 last year, there was a plan with a $5.20 a month monthly premium. Well, that is very affordable. So you pay about $60 a year to have your drug coverage, right? $5.20 a month, that's all. The premium for that same plan in this year went from $5.20 a month last year to $40.20 a month this year. So for people that did not compare that plan from last year to this year, or they did, and they know what they were going to pay going in, but they didn't look at any other plans, they may be paying $35 a month more in premium than they need to be paying. That's this year. Next year, think with me, 520 last year, 4020 a month this year. Next year, that same plan will be $90.20 a month. Guys, that is a very expensive Part D drug plan premium. So to go from 520 in 2024 to 9020 in 2026, that is very expensive. And a person that gets in that plan and stays in it and doesn't compare, that saddens me because they're paying more than they need to be paying. And not only are they paying more than they need to, can they afford to? So that's one example of if you don't compare your drug plan every year, even if you know going in how your plan's going to change, that doesn't tell you about the other options that are out there that may give you better coverage at a better cost. So you need to compare your plan every year. Don't just get in a plan and stay there, and don't just be comfortable. And I know Union County is in your Central Line AAA region. They have a white erase board that when people come in for SHIP counseling during open enrollment, they have that person hold up the white erase board telling how much money they saved during OEP counseling. And a few people, they were in the best plan from one year to the next, and it gave them peace of mind. So they didn't really save any money, but it gave them peace of mind. And so they held up a sign saying, I got peace of mind because I compared my plan and I know going into next year what my plan's going to be like coverage and cost wise. I'll give you another example. So it's very important to look at, we can look at up to 5 pharmacies when we do a plan search. And when you come in to meet with us or you call us over the phone, you need that red, white, and blue Medicare card, no matter how you have your Medicare, and you need a list of your current prescription medications, because that's what we put into the Medicare.gov website. They have a plan finder tool, and it does the thinking for us. We don't have to calculate that, but we relay the information from Medicare.gov to our clients. We have 5 pharmacy slots that we can fill with a person's current pharmacy. We can put mail order in if they're willing to look at that. Sometimes that saves a huge chunk of money. Sometimes it saves very little, may not be worth it. And sometimes it's more than retail. But we like putting that in if they're agreeable just to see what that cost is for mail order. Then we've got 3 other pharmacy slots that we can fill for pharmacies that are conveniently located that person, because there's out of network, in network, and preferred. And it makes a huge difference in cost, whether it's an out of network, an in network, or a preferred pharmacy. And my dad, in 2024, I was looking at his plans last fall during open enrollment, and the plan that he was in, the Part D plan, was going to be the same from last year to this year. But when I looked at the 5 pharmacies that we plugged in, the pharmacy that he used last year was not going to give him the best cost. No, it's my dad, and I can say, Dad, look at this with me. You are okay to stay in the same plan from 2024 to 2025, but let's look at where you're getting your medicines currently and look at the other pharmacies next year. Your best bet is to stay in the same plan, but maybe go to another pharmacy. It's my dad. I can say that. I can't say that to a client because if I did, the pharmacies would be calling me. But what I can do is turn the screen around or send them a printout to show them 5 pharmacy costs, including mail order, and where they are gonna what they're gonna pay at each of those pharmacies and through that mail order program. And I let them see what they think they should do. That's very important, guys. And so if you're just plugging in the pharmacy that client's currently using, or they're only looking at that, it narrows their choices and their options, and it really may not save them money. And because Centralina works with facilities, if a person is a resident in a long term care facility and that long term care facility uses a certain pharmacy, we have to plug that in. We don't look at other options because we only want to see plans. Medicare drug plans that work with the pharmacy that facility is using, and it may make $10,000 worth of difference. So that is the exception to that rule. So we want to remind people that it is open enrollment from now till December the 7th. And we want to remind people of why it's important to compare their plan, the drug plan, every year because the plans change every year and we want them to get the best coverage at the best cost. Supplements, if they're not new to Medicare and they don't qualify for guarantee issue, they can compare supplements anytime throughout the year. So we try not to compare supplements during open enrollment unless they're going to change from A and B to an Advantage plan or vice versa, because they can do that anytime throughout the year, but there may be underwriting involved and it might not be something that they are eligible to do. It just depends on their situation and company leniency on underwriting. So that's our message, and it's just very, very important for people to know that SHIP is here to help counsel during open enrollment. We are down some call center staff in Raleigh. So if people call and get a recording, they can call 800 Medicare 24 hours a day, 7 days a week. They can reach out to their local SHIP coordinating site, and we saw how to do that. If those appointments are busy, call the SHIP office in Raleigh. If the SHIP office in Raleigh is the line is busy, then call 800 Medicare. Or if you have an agent that helps you, as long as you're comparing every year, that's what's important. Again, our goal is that people have the best coverage at the best cost. I think that is everything that I have. I'm going to come back. And Lauren, can you think of anything that I did not mention, or did we get any questions along the way? I know we're right at 2 o'clock, but do we have any questions in the chat box that need to be addressed?
No questions have come in. I was in the process of typing a little reminder about Advantage Plan open enrollment. I don't know if you want to mention that
Yes,
briefly.
and thank you. So again, if people come into council with us, they need to bring their red, white, and blue Medicare card, no matter how they have their Medicare, Advantage or Original, and a list of their current prescription medications. A complete list is very, very helpful. Whether it's a printout or they bring their tubes and bottles in a bag, that's fine. And yes, thank you, Lauren. If a person has Medicare Advantage Part C, not only do they have the 7 weeks during Medicare prescription drug coverage open enrollment in the fall, but they have an additional 3 months from January 1 to March 31st of next year that they can make an additional change, or if they didn't do anything during open enrollment in the fall, they can make one change from January 1 to March 31st. But to be eligible to do that, you have to currently be in a Medicare Advantage Part C plan as of January 1. Okay. And there are special enrollment periods, guys, in addition to open enrollment in the fall for parts C and D, and in addition to part C, the first 3 months of the year. But that's kind of on a case by case basis, depending on what people's situations are. We've got documents that can help us determine if people are eligible for special enrollment periods. And if they are eligible for a special enrollment period for an Advantage or drug plan, we can help them enroll using the Medicare.gov comparison tool. We just tell the tool what their situation is as to why they can enroll when it's outside of open enrollment in the fall or outside of Medicare Advantage open enrollment the first 3 months of next year.
Jeannie, Michelle Holshouser has a question, so I'm going to unmute her so she can ask.
Thank you, Cindy. Hey, Michelle.
I think she actually chatted it in. We have a few in the chat box.
Oh,
Michelle
okay.
Great.
said, can you delay joining Medicare if you are working and have insurance through that? Which was also the same question that Dr. Korsha asked. Once you turn 65 and are still working and have employer health insurance, are you still required to sign up for Medicare? And then we also have one other question after you answer that.
Thank you, Lauren, and thank you, the two of you, for that question. So, the answer is maybe. We have a wonderful document on our website. If you remember the tic-tac-toe or Brady Bunch board, we have a box that says New to Medicare. And if you click on that, there is a document, if you scroll down, called The Road to Medicare. And it's a 4-page document that helps people transition to Medicare as they're turning 65. So, there are rules about the number of employees at the employer and if people are actively employed or not, and if they have a healthcare savings account. So there's a few things that determine should a person take out Medicare if they're still working or should they not. I would encourage you to pull up that document called The Road to Medicare on our SHIP website. In the box of the tic-tac-toe board that says New to Medicare, scroll down, scroll, click on The Road to Medicare, and that should help you. But reach out to SHIP if you have that question. Give us your situation, the specifics, the date that you're turning 65. We will ask how many employees there are. Is your employer plan in the form of a healthcare savings account? Are you actively working? There's questions that we're going to ask to determine what your situation is to give you the correct answer, because there's a lot of different answers and your answers determine what the situation is. So yes, you may not have to take out Medicare when you're actively working, but it just depends. And it's dependent on what your situation is, whether you're actively working or retired, and the number of employees. Okay?
And then
Thank
the
you for that
last
question.
question that came in is, if you pick supplemental plan G and find out the premiums are high for your monthly income during next year's open enrollment, can you drop to a lesser costing plan? Is a physical required or do pre-existing conditions come into play?
So the question is relative, thank you, Lauren, to Medicare supplement policies. Remember, Medicare supplement policies are not bound by open enrollment in the fall. Open enrollment in the fall from October 15th through December 7th is for the Medicare prescription drug open enrollment period. So it's the drug benefit. Supplement policies, there's 2 times that a company cannot turn you down for a Medicare supplement. One is when you're new to Medicare, you're either turning 65 or you're going on Medicare under age 65 with a disability. And in order to purchase a Medicare supplement, you have to have both Medicare Parts A and B. If you don't have both A and B, you cannot get a supplement. So supplements, unless you're new, that's your Medigap open enrollment, or you qualify for what we call a guarantee issue right for a supplement. That means you're losing your Advantage plan or you're losing your supplement. Unless you're new to Medicare and you're in Medigap open enrollment, or you qualify for guarantee issuance of a supplement, you can try to get a supplement or change supplements anytime throughout the year, but you may be subject to underwriting. They may look at your age and your health to determine if you can get a policy with them or not. And some companies are more lenient than others, but open enrollment in the fall, we try not to do supplements at that time because we have a limited amount of time and a limited amount of slots to try to get people situated for their drug plan for next year. Does that make sense? We can enroll people in Advantage and drug plans by going to the Medicare website and hitting the enrollment button, but we cannot enroll people in supplements. We can compare plans. We have a special database that we use, and then we can give them that comparison quote of the companies and the prices, and we give them a list, an alphabetized list of the 48-ish Medicare supplement companies that sell in North Carolina. They're licensed by our Department of Insurance with their phone numbers, and people have to call those companies directly to apply. We cannot help people apply for supplements or hit the enrollment button for supplements like we can C or D. But we really try not, unless that person is in an Advantage plan and they want to go back to original Medicare, we help them compare their drug plan, and then we would give them information about supplements. Other than that, if people are just coming in to talk about supplements, we try not to do that during open enrollment in the fall because that's not what that time frame's for. Hopefully that makes sense. And Lauren, please feel free to chime in anything that you want to add after I provide answers.
No, and I think you addressed everything. We did get a follow-up question. What do I ask to get the appointment to enroll and go over supplements if her retirement date is in March? And then we have another person interested in working through switching from an Advantage plan to original Medicare. So I'm going to make sure she has the info for her coordinating site. But other than
Yeah.
that, I don't see any other questions that have.
Thank you, Lauren. And that's a good reminder, guys. If it's a specific situation, we demonstrated how to find your local coordinating site. Please go to our website and pull that up. We normally can give it to you over the phone, but our call center is busy during open enrollment, so I don't want you to wait in that line when you can access that information, and we showed you how to do that. But for those specific questions, reach out to your local coordinating site, and again, give us information so that we can determine what the situation is and give you an appropriate answer. For people that are turning 65, we tell them to reach out to us about 3 months in advance of turning 65. Anytime before that's really too much. And then if you are considering retirement, reach out to you as soon as you decide what your retirement age is. Okay?
Well, Jeannie, thank you so much for taking the time, and Lauren, for kind of manning our questions and putting some wonderful information in the webinar chat. I know she gave some links and some websites and some phone numbers. So folks, make sure you take a second to kind of scroll back through those if you need to collect any of that information. Again, this webinar has been recorded, so if anyone needs to go back and listen to it or wants to share it with somebody, it will be located on the Centralina website in the next few days. So without
Thank you,
any,
Cindy.
you are very welcome. And without any further questions, we just want to thank everybody today for taking the time. I know that this is a lot of information, and it can be a complicated topic on the best of days. And I think that North Carolina is very blessed to have Jeannie and Lauren and the rest of the crew working as our SHIP representatives, and with the SMP, the Senior Medicare Patrol, and looking at all the fraud and really working hard to make sure folks aren't being taken advantage of. So thank you so much, everyone, for joining us, and we look forward to seeing you at the next webinar. Thank you, Jeannie. Thank you, Lauren.
Thank you. Happy Hump Day.
Thank you.
Thank you, Lauren Vanna.
I'm replying to one other answer before you cut it out or close
No,
it
I
down.
will leave it. I will leave it recording. I will
Okay.
stop the recording, but you can answer
Okay.
questions as you need to.
Okay.